What I would say is there's sort of two schools of thought, and I'll get to the Netherlands in a moment and what Red Light Holland's doing. And when I say there's two schools of thought, I think that we're looking at some of the points that Anne and Tim made and going, okay, here's the bigger companies, here's some of the more therapeutic and some of the more science and some of the ones that are focused on intellectual property and getting synthetics and working with synthetics to help maybe create some sort of big pharma company that one day will have a prescriptive model on getting you some sort of psychedelic that could potentially help with mental health. And I think that's the goal across the board here. And a little bit into what Tim touched on and a little bit more of what Red Light Holland does. And to answer your question is then there's working with the natural occurring substance of psilocybin in particular, where you can do that legally in the Netherlands. So there's synthesis, there's companies like Red Light Holland, and I'll get to the products in a moment, that work with the natural truffle, a magic truffle. A truffle that could be of a strain of a Tampanensis, a Mexicana, Calendoi, you name it. There's a bunch of different strains that contain the psychoactive ingredient within it, which is, of course, psilocybin. And what we're seeing is, you ask really as a broad question in a way, where is it going in Europe? I think we can't ignore where it's going on the social movement front in Europe and the way it's going really across the world. So both Tim and Anne mentioned big, great names, big advocates, huge pioneers, great scientists, great medicinal research going on, neuroscientists, you call it, you name it, amazing work that the people are doing there. Academia, quite candidly. But then there's the social movement, those who maybe aren't of academia, those who want to just help themselves, those who want to try natural occurring psilocybin to see what kind of impact it has on them. And we're seeing that across the board. Forget about just Europe. We're really seeing it across the world. And all anybody has to do right now, if they're going, whoa, that sounds conjectural, I don't believe you, go into a social media platform like a Twitter, a Facebook, an Instagram, type in microdose, type in hashtag microdose, read thousands and thousands and thousands of anecdotal evidence, really, of individuals who are getting access to these products, mostly illegal. So, you asked me where it's going in Europe. I'll tell you that it's almost everywhere, but it's illegal. There are websites where you can get microdoses or websites where you can get dried mushrooms. You could get a lot of different things, but it's illegal. So I think the question is, where's the legalities going and what companies are working within those legal frameworks and in what jurisdictions are those happening in? So Red Light Holland, for example, and back to the products that we have on shelves, we are working within the legal framework of the Netherlands. Tim mentioned that it's a industry that has existed for years. And quite candidly, I don't think the ayahuasca and peyote and stuff and some of those others are legal. But when it comes to psilocybin and magic truffles, they are. Magic mushrooms, in fact, aren't. They're on the 2008 Dutch opium list. So magic truffles you can work with. And what's sort of the idea around the magic truffles is that there is no true standardization with the natural occurring product, but there is more what people feel of this kind of consistency within the magic truffle than the magic mushroom. That's been talked about. And also there's been basically like no contraindications or zero incidents that's been reported with this stuff. So as a company, Red Light Holland, to ensure that individuals, both on the academia side, but both those who are very powerful on the social movement side, learn about these products. Because without education, quite candidly, all of us aren't doing what we need to be doing. And that's a disservice to the public to learn more. So as a company at Red Light Holland, we are doing it through education, information, promoting responsible use. We even have a thing in smart shops where you can buy our microdose packs, which are encouraged to use in small dosages. That's what a microdose is for those who don't know. Kind of self-explanatory, so you should. But if you think about it, in a little bit of a dose, really there could be zero contraindications. We want individuals to find their dose, to do it carefully, to start small, maybe go a little bit bigger, to figure out what their protocol is, whether it's on and off every 2 days, on and off every 3 days. Maybe they take a little bit more one day and don't use any more for 5 days. It's really up to the individual to find out how that best works for them. I can't tell you why to microdose, but we can learn from you why you do microdose. Does it help your anxiety? Does it help you focus and live in the moment a little bit more? Does it maybe help you with something even more severe going on right now? And that's what a lot of the studies in the FDA breakthrough therapy are trying to work with. In Canada, for example, the health minister has already allowed those who are terminally ill and those who have severe trauma to use natural occurring magic mushrooms, where the psilocybin is, to help with that trauma and really help with their anxiety as they're on their end of care, as their life very sadly is ending. And we applaud that decision, obviously. But these are the types of things, getting back to the product we have in shelves, that we want to make sure that people understand that this is a sensitive topic. It's a very powerful psychoactive ingredient within magic truffles. So you got to learn about this. And I hope that all the companies from the science side and from the recreational side, look at us, we're branders. Like, look, why is this guy got all this like alien looking light bulb kind of thing? Well, we're also branding a consumer goods product. And Red Light Holland has those iMicrodose packs at imicrodose.nl. We also have it online, in smart shops. And the beautiful thing about it, and then I'll stop because I know I'm getting long-winded. Let's leave some room for Ann and Tim here. But we have also worked with these legal frameworks in Canada and in Brazil outside of Europe to get a consumer goods product into Canada through a psilocybin import license, which is now at a lab being tested for COAs and for standardization and all that kind of great stuff. And also we've gotten it over into Brazil through Anvisa, which is their health regulatory body. In a consumer goods product, it's gotten over to Brazil. And the intention with Brazil is that it will then get prescribed to a patient for patient use, much like we saw cannabis happen in the day, where the natural occurring cannabis plant with THC and CBD was prescribed originally to help with things like cancer, terminally ill, AIDS patients, etc. So will the legalities follow that path while the science works on the synthetics and the big biofarm to prove out maybe some sort of true standardized drug, which could be prescribed like an Ativan or an Adderall, et cetera. So this is really where the conversation lies. And we do notice, though, that Europe is a very progressive market in wanting natural occurring products.
Yeah, I totally agree about that. We have the two routes that we have to follow. And I think that the most important one is coming from the community. It's coming from people who work with the natural substances. And we are very privileged in Europe that although it is not legal to send it or to buy it in Spain or in Belgium, we can just send it across the border. And most companies in the Netherlands, they actually do that without a problem. And I think it's really important that we support people doing this, to do this in a safe way, in a responsible way. And this is also why I believe that it's very important to have this kind of educational institutes or educational platforms like the one you have, or like what we have, to help people to understand what can be the benefits, but also the risk, because it is not without risks. You can say microdosing, it's a little bit, but with 1 gram, people can have also difficult experiences. People can have adverse reactions to that. It's not very common, but it happens. Some people, if they focus really on their experience with 1 gram of truffles, they feel like they have a lot more in their system. So it really depends on the persons, and it's all about educating people to see what is safe and what is not safe, I think.
Yeah, Tim, if you don't mind, one of the things that I do agree with you. I think 1 gram, at least from what we've dealt with, no one's had any issues yet, but we are a new company and we've sort of done these deep dives. We have scientists on staff. We have really brilliant people. A lady named Sarah Hashkas actually wrote a paper on the 5-HT2A receptors, now connects, and sort of giving you the theory on why psilocybin is working in part and parcel with the brain. She's even quoted by Robin Carhart Harris, actually, like really amazing stuff, the people on our team. But one of the things that we've done to try to mitigate any potential risk or any potential damages, one, we have a telecounseling app that people can immediately get in touch with a telecounselor, set up an appointment, and talk about their experiences and manage sort of what their dose is and talk about those things. So that's really important, face-to-face through like a Zoom chat like we're doing right now. We also have a digital care program. It's in beta right now, but it'll be launching literally in the next few days, I think, where you probably by the time this airs, Jonathan, where you can follow along and has like body predictive sort of movement data that if you're hunching over one day, it's sort of showing you that you're down and maybe you got to like put your shoulders back, really kind of very progressive talks here. And the other thing is we want to create a community. So we're trying to get community events together for people to share these experiences, to talk about them. And it always goes back to the so yeah, we totally agree with you. And to be honest, in terms of shipping outside of the Netherlands, we have to be careful doing that. We're publicly traded. We need legal opinions in every country, in every jurisdiction we go into. So it's if anything, that's that's a competitive advantage for private companies. But for us, we want to do it super responsibly, and we're quite proud actually of how that message is getting out there as a branding truffle, consumer goods brand. We've really been focused on kind of this very good corporate governance and very important empathy and education. So I think it's something that I hope all companies really focus on too.